Thank you very much. So you have heard and you know about the electrical baroreflex activation, and you have seen the results in one of the prior talks. We are doing the same, but using a mechanical implant, which is implanted into the carotid bulb. So it does not need a battery. It has to be replaced. It stays there forever, basically. It's a self-expanding rectangular nitinol implant. It kind of reshapes the carotid artery without expansion. It retains pulsatility. It increases the carotid artery strain and stress and amplifies baroreceptor signals to the central nervous system. Basically, it creates a larger effective arterial radius, and this results in the increased stress of the carotid wall. It has to be shown to be effective in resistant hypertension. This is from the randomized trial, and you can see that this, unless as carotid stenting, is a long-lasting effect. So up to 3 years, we saw a significant decrease in blood pressure after device implantation compared to placebo. We are now using this technique to treat heart failure patients. It's the EVBA for heart failure trial, a feasibility study targeting patients are heart failure patients with systolic heart failure, obviously, typically heart failure class 3, and they are in need for treatment options beyond medical treatment and CRT, but not yet candidates for LVAD or heart transplantation. Key eligibility considerations are plaque-free carotid artery. We don't want to include any patients who had carotid artery plaque. Stable medical therapy, ejection fraction below 40%. As mentioned earlier, heart failure class 3, 6-minute walk distance should be between 150 and 400 meters, and NT-proBNP more than 400. This shows you the technique where we implant the device. This is the target area here, the proximal carotid internal artery. We have to make sure, again, that there is no plaque, standard access like carotid stenting, and we deploy the device in this area here. We do not use distal protection because there's no diseased artery. This shows you a sequence of angiograms. This is the device in place. The distal part is deployed. At this stage is fully retrievable, and only when you deploy the proximal part, then it's obviously not retrievable anymore, and this shows you the final angiogram after release of the implant in the correct position. These are the patient demographics and baseline characteristics. So typical cohort of patients with systolic heart failure. Mean age was 60. Ejection fraction was about, 30%, 33%. Heart failure class 3 and 97%. 6-minute walk test, 230 meters. So these are the baseline characteristics. Procedural details. Procedural time was 29 minutes. The implantation time was 5 minutes. Fluoro time, 7 minutes, and the implantation was successful in all 33 patients. What's about adverse events? It's a very safe procedure. We did not see any procedural complications, strokes, or TIA. There had been 4 patients with small asymptomatic MRI lesions on discharge MRI, all fully resolved after 30 days or after 1 year. That's actually something we see also after diagnostic angiography. Very few post-procedural serious adverse events, and most of them are definitely not associated with the device or the procedure. This is the most important slide of my presentation showing the results. There was significant improvement in all parameters, and all patients improved in at least one parameter. You can see quality of life increased from mean 40 to almost 60, 6-minute walk test from 200 to almost 300 meters, NT-proBNP from 1,000 down to 700, and ejection fraction increased a little bit from 35 to 38%. All these differences, as mentioned earlier, are significant. We looked at individual responder analysis, and we looked at the clinical meaningful improvement, and moderate or large, when you look at the quality of life, that means more than 5 points is moderate improvement, more than 10 points is large improvement. We could achieve that in 86 and 67%. 6-minute walk test, more than 30 meters was considered to be moderate, and more than 50 large improvement, 100% and 62%. And NT-proBNP decrease, more than 10% in 81% and more than 30% in 48%, and this is a long-lasting effect up to 12 months. So in summary, it's a straightforward procedure. All implantations had been successful, significant improvement in heart failure class, 6-minute walk distance, quality of life, ejection fraction, and NT-proBNP. The study is ongoing, and the larger pivotal study is planned. Thank you very much for your attention.